Hello, I'm Dr. Karyl Rattay, and I'm the Director for Delaware's Division of Public Health. Today, in conjunction with the Delaware Cancer Consortium, we released our annual cancer data report, Cancer Incidence and Mortality in Delaware, covering 2011 to 2015. As always, we are pleased to celebrate our collective successes while acknowledging the vast amount of work that still needs to be done to save lives from this disease. The good news is that in Delaware, fewer people are dying from cancer. Our cancer mortality rates continue to decline, largely due to increased screening and early detection, as well as advancements in treatment. The state now ranks 18th among states for highest all-site cancer mortality, which is 2 slots better than last year's report. Delaware's all-site cancer mortality rate decreased 14% from the early 2000s, which is the same percentage decline that is seen nationally. Additionally, we are seeing notable decreases in the mortality rates for specific populations. For instance, there has been a 30% decrease in the all-site cancer mortality rate among African American men since the 2001-2005 timeframe. However, we are not making the same sort of progress when it comes to reducing the number of new cancer cases diagnosed in Delaware. Despite small decreases in cancer incidence over time, Delaware remains ranked second in the U.S. We have been ranked second highest in the nation for the last 6 releases of this report. And while initially we attributed our ranking to increases in early detection through improved access to screening, we can no longer fall back on this explanation only. By now, we should have made more progress. Yes, there are genetic and non-modifiable risk factors for almost every type of cancer. These we cannot control or do anything about. However, there are so many things we can control. Approximately 40% of all cancers diagnosed in the U.S. are now linked to overweight or obesity, the same percentage associated with tobacco use, according to the Centers for Disease Control and Prevention. Most people know they should eat better, exercise more, and stop smoking. Responsibility absolutely falls on individuals for enacting behavior change. But preventing cancer also requires that policies, systems, and the environment support healthy choices. On the health policy side, the General Assembly made a great start by passing 2 important bills this session. Senate Bill 25 raises the legal age for sales of tobacco and vape products in Delaware from 18 to 21, making it more difficult for youth to access tobacco and tobacco products. The new law takes effect July 16, 2019, and we expect it to have a significant impact on tobacco initiation in our state. Additionally, legislators passed House Bill 79, which would make water, sparkling water, flavored water with no added sugar, flavored or unflavored milk, or 100% fruit or vegetable juice the default beverage in bundled children's meals. This is one way of making the healthy choice the default choice. And while I've heard criticisms of these bills reflecting a nanny state, the bottom line is that we're an unhealthy state. And as supported by the evidence, implementing these policy-level approaches makes healthy choices easier. DPH provides a wide variety of resources to help people be healthier. We provide smoking cessation assistance through the Delaware Quit Line. And we partner with the Delaware Cancer Consortium through healthydelaware.org to promote physical activity and healthier eating. For example, we highlight the Department of Agriculture's listings for farmers markets and provide many healthy eating and lifestyle tips on our website. But what if you want to be more physically active, but don't feel safe walking in your neighborhood after dark? Or you don't have money to pay for a gym membership or transportation to get there? Or what if you want to eat healthier, but a farmer's market is not close to you? Or you don't have a job that pays enough to afford buying healthier foods in the supermarket? Collectively, we have to address these social determinants of health that are real-life barriers preventing people from being healthy. DHSS and our lead partners in the Healthy Communities Delaware initiative, including the University of Delaware and the Delaware Community Foundation, are looking at the underlying conditions that cause communities to be unhealthy and are working on strategies to alleviate those barriers. If we want to have fewer people diagnosed with cancer, we need to continue to improve and enhance cancer screening and treatment, but also to invest in cancer prevention by addressing risk factors and social determinants of health. If we do nothing, or not nearly enough, we will continue to be in an unhealthy state and lose far too many people to cancer and other preventable diseases.